There we go. We not only save these conversations to a YouTube channel, but I emailed the link out to everybody who registered. So if ever you register for one of these and then at the last minute, I know what life is like when you're a caregiver. Last minute you can't make it, don't worry about it. We'll make sure you get what you need. So without further ado, oh wait, I did want to talk about this, about questions. So Jenna is probably going to be chatting for maybe 20 minutes or so. If you could type your questions into the chat rather than speaking out in the moment, that would be best. And then while you're at it, if there are other things that you're really hoping that you can that we can talk about a little bit today, just pop that into the chat as well. Because when Jenna is finished, we will first respond to any questions that have to do with her topic. And then after that, let's just visit anything, whatever you've got going on that you feel like you need somebody to just like a reality check, or you need somebody to help you problem solve. That is why we are here, all of us. So let's go ahead and without further ado, I'm going to let Jenna introduce herself. And I know she'll be sharing some slides. Jenna, will you be cool with us possibly sharing the slides out like as a PDF afterwards?
Oh, yes, of
Okay,
course.
great, great. So we'll make sure we take care of that.
Okay.
Alrighty. So Jenna, go ahead and kick us off.
Okay. Wonderful. I am first gonna share my screen. Okay. Is everyone able to hear me and see the screen? It's blue and black and says, "Can therapy help when someone has dementia?" Okay, I see a
This is
thumbs
thumbs
up.
up. Yeah.
Okay. Wonderful. Um, I also wanted to note that you might see me looking down, and I apologize. It's because I'm reading notes that are on my cell phone. So if you're wondering, where are her eyes? That's what I'm looking at. So, hi everyone. My name is Jenna Rumberger. I'm a licensed independent clinical social worker, and I'm in Washington State. So, I'm on the east side in Redmond or Bellevue, and I have a solo private practice called Aging with a Plan. So, I get to help adults and older adults who are navigating dementia, Alzheimer's, and Parkinson's challenges to help them find clarity, support, and peace of mind through compassionate therapy, and then also the practical guidance as well. And that means that I get to work with both the person living with the disease and the caregiver. So, my professional background is all in medical and geriatric social work, but on a personal level, my grandmother Betty lived with Alzheimer's disease for a decade. And so, watching my grandmother change and decline over time with her memory, her communication, her personality, it was really heartbreaking. And also seeing my mom as the long distance caregiver, how stressful and sad it was for her, and how challenging it was, to navigate all the different healthcare systems and then making decisions that tries to honor, our person's preferences and their quality of life. So I do have that personal experience as well, which is really why I wanted my work in Aging with a Plan and my private practice to focus on this population because, when my grandmother was first diagnosed, our experience, which I think maybe some of you can relate to, was just the primary care doctor like, here's a pamphlet on what is Alzheimer's and good luck. We'll see you in a year. And then you're just left wondering, okay, well, wait, what is this diagnosis? What does this mean? And really, of course, I learned quickly that the disease impacts the entire family system. All of the family and friends of the person who is living with the illness, it impacts all of us, right? So, a quick overview. I'm so glad you all are here today. So, when someone you love is living with dementia, there are often a lot of different losses and adjustments, right? Some of them are visible that we can see, but some of them are also invisible. So, therapy or mental health support can often look a bit different than people expect. So, today I'm going to talk about how you understand when therapy can help, how it helps, and then how to actually find a specialized therapist, someone who knows what dementia is. So you might be sitting here wondering, is therapy even useful when someone has memory loss or cognitive impairment? How do we talk about feelings if my person can't even remember some of our conversations? And then is this for them or is this for me? Is it for both of us? Right? So we'll be talking a little bit about that today. So before we dive in, I just want to clarify that dementia-informed therapy, it does look different than what people imagine because it's not about fixing their insight, their memory recall, or like fixing or erasing their emotions. That's not what it's about at all. And dementia informed therapy can often look a bit slower, a little bit quieter than what traditional therapy is. There may be some repetition, some pauses, but that's all part of the work. So, really, the goal is trying to help our person feel safer right now, right? So the therapy focuses on emotional regulation, so helping someone settle when they feel overwhelmed or stressed. It focuses on validation, meaning being heard and believed, even if some of the details aren't totally accurate or true. And it also focuses on preserving dignity, especially as abilities change. So, therapy, again, or in addition, is about reducing distress in the moment. So, that might mean a little bit less anxiety, agitation, or emotional withdrawal. Not all at the same time, but maybe a little bit more often. And it's also about supporting identity and meaning, right? So, helping someone still feel like themselves, even as things are changing. So, in practice, this can look like helping someone express their feelings like sadness, worry, anger, without needing insight into why exactly they feel that way. It can also mean supporting adjustment to so many different losses, like driving, independence, or their changing roles. And it's really about offering a calm and neutral space that's separate from the family system, where emotions don't need to be managed or fixed. So, therapists like myself, they may use different modalities or approaches, such as supportive therapy, validation based strategies, reminiscence, or emotion focused techniques. And you don't have to know all these terms. Really, it's just about being present with our person and meeting them where they are in that moment. So, being flexible and being adaptable is key. So, what therapy can do? So, therapy can help with things like depression, anxiety, fear, or frustration. It can help with shame or embarrassment about cognitive decline. We can talk about some of the different losses or adjustments that they're going through with their identity or their role. It can also be about emotional expression when sometimes words are harder to say or to find. And then again, about maintaining connection and quality of life. So it's really, again, about helping that person feel safe, heard, and understood. So, what therapy cannot do? Unfortunately, therapy cannot restore someone's memory or insight. It can't stop the disease from progressing. It can't make someone, quote, accept dementia on a logical level. And of course, therapy does not replace the amazing work that you all do as caregivers or medical care or support, environmental support. So you might be wondering, how do you actually talk to your person about seeing a therapist. So from your perspective, you might be thinking, oh gosh, maybe my person living with a dementia diagnosis, maybe they would really benefit from talking to someone, a professional, right? But how do I actually address this with them, right? This can sometimes be a really delicate subject because, as you know, dementia can impact the person's insight, maybe their trust, or their tolerance for change. Change is really hard, and the person is already going through so many other changes. So, how do I even approach this conversation with them, right? And so, it's really about um, leading with concern, not correction, focusing on how they're feeling, not the diagnosis. And of course, we always want to respect their autonomy, even when their capacity is changing. So the goal isn't necessarily to convince our person or like argue with them, like, hey, you got to go talk to someone. That approach is not going to work. Um, Again, it's about these three steps. So, this is an example of what you could potentially say to your person, but of course, you know your person best. So, you want to adjust this or tailor it to your specific person. Um, but you could say something like, hey, I'm noticing that you just don't seem like yourself lately. You're staying in bed a lot more and you seem more down than usual. And I'm feeling worried or concerned about you. Can I help you find support? Can I help you find someone else to talk to? So, this is again just one example on what you could say. And of course, we can share all the slides with you so you have this information. And at the end of the day, if your person says no, again, we don't want to force anyone to do anything unless there's a genuine safety concern, right? Um, but in this instance, sometimes it's revisiting the conversation again. If our person says no, you could maybe gently ask, can you tell me a little bit why you say no? What's your hesitation or what's your worry with this, right? Again, sometimes new things or changes can just feel too overwhelming that we might just shut it down and immediately say no. Or maybe they don't even know what a therapist actually is. And then also taking into account someone's background. Sometimes with older adults, they have a very negative association on what a therapist is. Um, but the reality is that the landscape of mental health in general has changed a lot over the last few decades. And so it's not just for when someone is experiencing a crisis, right? So some people may have a misunderstanding, right, about what therapy is, or like, well, I'm not going to kill myself. Why would I go see a therapist? And it's like, well, it's not just for crises or extreme situations. It's just helpful to have someone outside of the family, someone that you can just be completely yourself with and talk through how you've been feeling, right? Because what I've seen a lot is people with living with a dementia diagnosis, I do see quite a bit of depression, a lot of sadness, a lot of withdrawal, some embarrassment, and it's hard. Okay, so I wanted to talk to you about one of my amazing clients. And this is just one example, right? This is not to suggest that therapy works for everyone, but it's just to kind of show could potentially, um, what could potentially happen with dementia informed therapy. So I'm thinking of my client. I'm going to refer to her as Mary. So when I met Mary in July 2024, she was 79 at the time, and she had been diagnosed with early stages of Alzheimer's disease. So the year prior, and I'm not sure if she had a formal diagnosis of aphasia, but she definitely had some communication speech problems. And so she has been married for over 50 years. So her spouse is the primary caregiver. So the two of them live together. And they are living in a senior living community and they're on the independent side. So there's not any professional caregivers going into the home. So when I first met Mary, she felt sad and embarrassed. She knew that her brain was changing. She would say, I just can't remember things the way that I used to. And then also her speech, she would sometimes lose her train of thought, or she wouldn't remember what certain words were called. And it really took a hit on her confidence. And she started to withdraw socially. She was someone who historically was very outgoing, very social. Her career, she worked in education as a teacher, as a librarian. So she was always with people, communicating. And then when she retired, she was doing a ton of volunteer work. She was in the community, raising money, working at events. And so her family started to notice that she was, again, in bed a lot and wouldn't go see her friends, wouldn't go play cards, didn't go on her walks. And so they were feeling really worried, and the family reached out to me. So our therapy focused. So number one was just hearing her out, really validating and normalizing her feelings and concerns, right? It makes sense why you feel sad. That sounds really hard. I would love to hear more about that. And then once we were able to build some of that rapport, that trust together, she started to feel safe, more comfortable, right? Then we were able to start to look at her routines, because as we know, routines are so important. And so I asked her, what do you enjoy doing? What lights you up? What brings you joy? What makes you feel relaxed? And so I was able to learn about what she likes to do as an individual. And then we were able to look at the activity calendar where she lives at the senior living community. She got back into water aerobics, movement exercise. That was super important to her. She loved going on walks. Um, and then also her family helped connect her to speech therapy, since that was really one of her biggest concerns. She's like, I just can't talk the same way that I used to, right? Um, and we also did some reminiscence therapy. So we were able to, which I love doing with people, is for example, you can look at old family photo albums together. And oftentimes we see with dementia is yes, the short term memory goes, but the long term memory is still there. And so, for example, we looked at her senior high school yearbook, and she was telling me stories about her high school experience and some of the friends, the girlfriends that she had there, and some of the groups that she was a part of. We looked at her wedding album too, and she was able to share some stories of her family and how she met her husband. And I could just see her expression, how that changed, right? It was fun for her, enjoyable for her to talk about some of these memories. So, some of the outcomes that I saw, she felt more in control, more confident. She did re engage socially. She returned back to some of her hobbies and activities, not everything, because some things were just, she felt like they were just out of reach for her, right? So we adapted things. And then she got really into these brain health exercises. And I think a lot of that came from her speech therapist too. Like she was getting really into puzzles. But she did say, some of these puzzles and things are pretty draining, right? Like she struggles a lot with fatigue and feeling tired, which again is so normal because when your brain is changing, it's kind of working on overdrive. And so events and games and interactions can sometimes feel really draining too. So every day or every week didn't always look like this. There were events that she didn't want to go to, but that's totally okay. Overall, she was much more engaged in her life. And some of her, feelings of sadness and embarrassment, it definitely um, got a little bit better over time. Of course, it can't erase those feelings. And again, that's not what therapy is about. But she did start to, again, feel, more comfortable, more confident. And that was wonderful to see. And I still get to work with her. So um, she's great. And it's an honor that I get to work with this client. Okay, just going to take a sip of water here. Okay, so how do you actually find a therapist? Whew, this is often the place where people get overwhelmed or stuck. So I just want to normalize that because it is very hard to find a therapist, as you probably know. Um, so you don't have to have everything figured out. Oh, sorry, looking at the wrong place. I'm reading on my notes right now. I'm sorry. Okay. So I'm not an insurance expert by any means, but I do just want to make a quick note about insurance. Because from what I understand, Medicare specifically does not cover therapy if it's just supportive therapy. So, what I mean by that is Medicare does cover therapy when it's medically necessary. So, that could be, for example, in the treatment of anxiety or depression when our person is living with dementia. And so I know that it's harder for folks to find a therapist that actually accepts Medicare. And that's really a systemic problem, unfortunately. Um, but a great place to start is going to Medicare.gov so that you can search specifically for a mental health provider in your area. And so when you do see the list of names, what you want to do is to call them and say, hey, are you accepting any new clients right now? And then, of course, do you have experience working with people either with dementia or some type of cognitive impairment? Another option is there are so many different online directories. I really suggest starting with Psychology Today because that directory has been around for decades and it's the most well known directory, meaning there are a lot of therapists using Psychology Today. And again, you can use Psychology Today and filter. So you want to type in your location, your insurance, and then specialty. You can look up by either caregiving if you're looking for you or if you're looking for your person, you can put in dementia. Some people like to ask their primary care doctor for any referrals or suggestions, or maybe you have some trusted family or friends who might have worked with a therapist who specializes in dementia. So I always recommend asking them as well. And then some people prefer to pay out of pocket, so pay privately. So I do want to acknowledge that for some folks, cost can be a real concern. So it is completely um, fine if you reach out to a therapist and you can ask them directly, do you have any sliding scale or reduced fee options? Right? Every therapist is a little bit different. They might say yes, they might say no, but it's always, always, always worth asking. And there is a specific online directory that's just for reduced fee or sliding scale options, and that's called Open Path Collective. And I believe it's a one-time fee to become a member of Open Path Collective. And then you have access to, a whole list of therapists who do sliding scale. And I believe the cost is between $40 and $70 per session. So that's an option as well for folks. All right, so how to actually get started. So hopefully you can find a couple, if not one, maybe a couple different options. And then you want to reach out to those options, those therapists, and say, are you accepting new clients? If you're using insurance, do you accept Medicare? And then can we schedule a free consultation call? So, a free consultation, most all therapists do this, not everyone, but I would say the majority of people do. And it's typically 15 minutes, maybe 20 minutes. And it's really just a casual conversation. And so you don't have to have everything figured out in that consult call. You don't need to be super clear on what exactly your goals are or what exactly you need help with. But it is an opportunity to say, hey, this is what I've noticed. These are my concerns or my questions, and then get a sense of that therapist, right? Do they have experience with dementia? What is their approach? Does this feel like a good match for my person? And also, I do like to say that research has consistently shown that the therapeutic relationship is much more important than the therapist specific technique. So it's really at the end of the day, the most important thing is, does the person who's receiving the therapy, do they feel heard, understood, and respected? That matters so much more than just that specific modality, technique, or training. Okay, so here are some questions you could potentially ask on that consultation call to determine if you feel like this therapist is a good fit or not. You don't have to ask all five of these. These are just some ideas, right? And then you get to decide based off of you and your person, like what does feel most helpful to ask, because the consultation call, like I said, it's usually between 15 or 20 minutes. It really goes by quite fast, right? So you might start by asking the therapist, like, hey, what experience do you have working with someone with dementia or cognitive impairment? Is that something you're familiar with? Are you comfortable with that? Um, and then, of course, you want to share like a little bit about what you or your person is needing, right? I'm feeling really sad. Ooh, I'm just feeling so on edge. I'm feeling so nervous and worried, right? So that they have an idea of what you're needing or what your person is needing support with. And then you could potentially ask the therapist, how do you support or approach therapy when there are common concerns related to sadness, anxiety, frustration, or loss of independence? What type of therapy do you practice? Like what modalities, what interventions, and how are you able to adapt that or change that as someone's memory or insight changes? How do you support clients through major life transitions? So, for example, retirement, maybe there's a big health change, maybe someone's moving, or are there shifts in the family roles? And then, of course, you always want to talk about some of the logistics of everything, right? Insurance or payment scheduling is a big one, right? What days and times do you have sessions available? What will your involvement as a caregiver look like? What are some of the communication preferences? So, yeah, those are just some ideas of things you can ask about. And also, I do want to note that if you do find a therapist and you're like, great, this seems like a good fit, the insurance or payment is good, scheduling's all good. I usually tell folks in general, please give the therapist, I would say, like 3 sessions before you figure out, is this a good fit or not? Unless, of course, there's like a huge red flag and you're like, oof, this is not good for my person. That's okay. It's just at the beginning of therapy, um, we do what we call an intake assessment. So it's like we're asking so many questions of the person, and we're not actually getting into like the meat of therapy yet. And so oftentimes in general, not just dementia specifically, but in general, people feel like they feel worse before they feel a little bit better in therapy, right? Because you are opening up about, or your person is opening up about their hardships, what's causing them stress, what's causing them fear. And that's a lot to verbalize, right? That's a lot to get off your chest and say, like, this is where I'm really struggling. And so, yeah, it can feel worse before it gets better. So hang in there if you can, at least a couple sessions. And then if you figure out, like, hey, this therapist, this is not a good match, I'm either concerned about this or something feels off. If you're comfortable, I always recommend telling the therapist, like, hey, this is not working, or hey, I'm really concerned or unclear about this. If you're able to have that conversation with the therapist, that is great. Um, they could hopefully find you referrals for other people, right? And sometimes it's just not a good match, and that's okay. Sometimes we need to shop around a little bit before we find a good therapist, a good match. Okay, that's all I have. Thank you all so much for listening. I appreciate you all being here. And yeah, I would love to hear if you have any questions that I can help answer.
Jenna, thank you so much. I learned a ton, and
Yay.
I wish I had had this conversation years ago. Um,
Oh,
yeah, if you wouldn't mind stopping your share, that would be great,
yes.
so we can see